Welcome to the Deep Dive. We delve into stacks of information, pull out the key insights, and share them with you. Today, we're looking at something maybe a bit obscure, but really quite serious for some, well, frankly, majestic animals: camels, llamas, deer, elk. It often gets called mouth rot. Sounds pretty bad, right?
It does. The scientific name is necrotic stomatitis, or sometimes oral necrobacillosis. Essentially, it's an infection causing tissue death necrosis and ulcers inside the mouth.
Right. So our mission for this deep dive is to get you quickly up to speed on this. What causes it? How does it actually show up in these animals, and what does it mean for them? We've gathered info from, comprehensive veterinary reports, scientific articles, basically the expert view on animal health.
Okay.
So mouth rot. We've established it's more than just a nasty name. There's this unseen threat. What's the actual bug responsible here? What makes it tick?
Yeah, the main player is a bacterium called Fusobacterium necroforum. And the interesting thing is it's not some rare pathogen. It's anaerobic, meaning it hates oxygen. And it's actually pretty common found in the environment, even in the gut of healthy animals.
Okay, so it's normally there.
Exactly. The crucial point is that it's an opportunist. It sort of waits for an opening.
Ah, so it can't just attack healthy tissue on its own. It needs a way in. What kind of things give it that chance?
Precisely. The sources really emphasize these predisposing factors. One big one is simple mechanical trauma. Think about coarse, stemmy feeds scraping the inside of the mouth, or, chewing on something sharp they picked up. Even teeth coming in can create those little injuries.
Okay, physical damage. Makes sense. But I gather it's not just that. What about other illnesses?
Right. Viral infections are another major factor, things that cause sores or blisters in the mouth first, like vesicular stomatitis or malignant catarrhal fever, MCF, or, especially in deer, EHD, epizootic hemorrhagic disease. These basically create the perfect entry points for F. necroforum.
So the virus kind of opens the door.
It really does. And beyond specific injuries or viruses, the animal's general state is, well, critical. Stress is a huge one. Think about transport, weaning, overcrowding, even just poor nutrition. All of these things can weaken the immune system, make the animal susceptible.
Okay, so the defenses are down. F. necroforum gets in. What does it actually do then?
Well, once it's in, it releases these really potent toxins. One type, leukotoxins, specifically destroys immune cells, the animal's defenders. Other toxins cause something called coagulative necrosis. It's a type of tissue death where it gets firm and kind of opaque.
It's pretty sobering how a small cut or stress can spiral like that. And you mentioned it's not always working alone. There's this synergy with other bacteria.
Yes, that's a key finding. It often partners up, especially with bacteria like Truparella pyogenes. They work together, creating that anaerobic oxygen-free environment where F. necroforum just thrives. And this teamwork leads to those really characteristic lesions, foul-smelling, often sort of cheesy. The term is caseous.
All right, that caseous discharge. So if you're looking after these animals, or maybe observing wildlife, what are the very first signs, the early warnings?
Yeah, the early signs are often quite similar across the different species. You'd look for increased drooling, maybe they're suddenly unwilling to eat or eating very carefully, and that really bad breath halitosis is a big clue. Sometimes you might see visible pain when they try to chew, or even some slight swelling around the face or jaw.
Okay, let's focus a bit. What about camelids? Llamas, alpacas? The reports say necrotic stomatitis often shows up as a secondary issue for them.
That's right. While things like stomach ulcers aren't super common in camelids generally, necrotic stomatitis can definitely pop up, especially, as the science points out, if the animal's immune system is already compromised, maybe due to a chronic illness like cancer neoplasia or even something like kidney failure. Their defenses are already low.
So for a llama or alpaca, what does that look like specifically? The lesions, the overall effect?
You'd see these ulcers in the mouth, maybe the back of the throat, the pharynx, sometimes even down into the esophagus. They can be separate spots or merged together multifocal to coalescing. And they're often covered with that dead caseous material we talked about, plus that foul odor.
And it affects the whole animal, not just the mouth.
Oh, absolutely. Systemically, you see things like anorexia. They just stop eating weight loss. They seem depressed, lots of drooling. And you might see that swelling in the cheek or jaw area, too.
How do vets actually pin down the diagnosis? And what else could it be that looks similar?
It usually starts with a good clinical exam, looking closely at the mouth. To confirm, they'll often take a swab for a bacterial culture. That identifies Fusobacterium necroforum directly. Sometimes histopathology looking at a tissue sample under the microscope is helpful, too.
And ruling other things out must be key.
Definitely. Differentiation is crucial. You need to make sure it's not vesicular stomatitis or maybe just a bad dental problem or even referred pain from something like gastric ulcers.
Okay, so in a farm setting, how do you treat it in camelids? I hear drug use can be a bit different for them.
Yeah, treatment needs to be prompt and pretty aggressive. Systemic antibiotics are the main tool. Vets often reach for drugs effective against anaerobes. Penicillin, metronidazole, oxytetracycline are common choices.
And the off-label part.
Right. It's important to know that many drugs aren't specifically licensed for use in llamas and alpacas, so veterinarians use them off-label based on their clinical experience and knowledge of how the drugs work in other species. It's a common practice in camelid medicine.
Makes sense. But it's not just antibiotics, is it? What about supportive care?
Oh, absolutely critical. Supportive care is huge. You need to provide soft, easy-to-eat food, maybe even syringe feeding or fluids if they're dehydrated. Pain relief is important too. Using NSAIDs like flunixin meglumin helps with pain and inflammation.
And managing the actual lesions.
Yes, gentle cleaning is good. Carefully removing the dead tissue, that's debridement, and flushing the area with an antiseptic can really help.
What's the outlook usually?
If you catch it early and treat aggressively, the prognosis is generally pretty good. But if it's advanced, if there's a lot of tissue damage or complications like aspiration pneumonia, then it becomes much more guarded.
Given all that, prevention is like the way to go. What's the bottom line for preventing this in camelids?
It really comes back to managing those risk factors we discussed earlier. High quality feed that isn't abrasive, minimizing stress, good handling, comfortable housing, keeping feed and water sources clean, and crucially, dealing with any underlying health problems quickly so their immune system stays strong. Prevention is definitely key.
It's really interesting how those basic principles apply. Let's switch gears now to deer and elk cervids. How does mouth rot look in them? Is it different?
Well, it's certainly a recognized problem in both wild and farmed deer and elk, and it's often linked to tough environmental conditions. Think poor quality grazing or browsing, malnutrition, especially in winter when food is scarce.
So lack of good food makes them more vulnerable.
Exactly. And animal health experts note that the very young fawns or calves and also older animals with worn down teeth are often the most susceptible. Their mouths are just more easily damaged or they're less resilient.
What signs would you see specifically in deer or elk? Any unique complications?
The signs are quite similar, actually. Necrotic ulcers inside the mouth, on the tongue, back of the throat. It can sometimes cause swelling in the jaw area that might look like lumpy jaw. Though it's important to know, true lumpy jaw is usually a bone infection called actinomycosis, a different thing.
But the outward appearance might be similar.
Yes, potentially. Systemically, you'll see the same kind of things.
Yeah.
Lethargy, depression, not eating, losing weight fast, drooling, obvious trouble swallowing.
And I remember reading Fusobacterium necrophorum can cause problems elsewhere in cervids too, not just the mouth.
That's a really critical point, yes. Unfortunately, it's not always contained. It can cause foot rot in deer and elk as well, and it can spread systemically through the bloodstream. This can lead to abscesses forming in vital organs like the liver or lungs, which are often fatal.
Wow, okay. How is it diagnosed then? Especially comparing wild deer versus farmed ones.
In farm deer, it's usually based on seeing those clinical signs we talked about. In wild populations, though, diagnosis is often made after death during a post-mortem examination. It's just harder to observe sick wild animals closely.
And again, ruling out other diseases must be vital.
Absolutely crucial, especially in deer where other diseases cause similar signs and die-offs. Things like EHD, blue tongue, MCF, they all need to be considered and differentiated.
So treatment and prevention, how does that work, particularly with the challenge of wild animals?
Yeah, for wild deer, treatment just isn't really feasible most of the time. Catching them is difficult and stressful, which could make things worse.
Right.
But for farm deer and elk, the approach mirrors what we discussed for camelids. Early antibiotics are key penicillin or tetracyclines. Often vets will use long-acting formulations to minimize how often the animals need to be handled. And supportive care, sock food, clean water, maybe draining accessible abscesses if possible.
So for farm deer, it really boils down to good husbandry again.
It absolutely does. Excellent husbandry is the cornerstone of prevention. That means managing the environment, avoiding overcrowding, keeping areas around feeders clean and dry to limit contamination, careful nutritional management, providing good quality feed, avoiding abrupt diet changes, and again, minimizing stress wherever possible.
Is there any kind of vaccine?
There isn't one specifically licensed for F. necroforum in deer. Some people try using cattle bacterins off-label, but the research hasn't really shown definitively how effective that is in cervids, so management is still the main focus.
Okay, let's tie this all together. We've looked at camelids, we've looked at cervids. What's the big picture here, the common thread?
I think what's really striking is how consistent the story is across these different species. You have this opportunistic bacterium, Fusobacterium necroforum, playing the central role, and its success hinges almost entirely on those predisposing factors, the initial injury, the stress, the underlying illness. That pattern is incredibly consistent.
So the aha moment, if you will, isn't really about the bug itself, but about the breach in the defenses, that initial vulnerability.
Exactly. That's the core insight, I think. The disease almost always starts because something compromises that protective barrier in the mouth, the oral mucosa. It highlights that the unseen threat isn't necessarily the bacteria in the environment, but the factors that let it gain a foothold.
And why does this matter beyond the individual animal? What are the broader implications for, wildlife management or farming?
Well, it matters a lot. This is a painful, debilitating condition. It can be fatal. In farmed animals, that translates to significant economic losses. In wild populations, it's a recognized cause of mortality, sometimes significant die-offs.
So this deep dive really underscores a more holistic view of animal health, doesn't it?
It really does. It pushes the focus towards prevention, towards sound management, good nutrition, reducing stress rather than just reacting with treatment after the fact. It's about building resilience.
So maybe a final thought for everyone listening. Consider how this concept, an opportunistic invader exploiting existing vulnerabilities, plays out elsewhere. What does understanding necrotic stomatitis tell us about the kind of hidden importance of seemingly small things like a tiny cut or a bit of stress in determining overall health, whether it's in animals or even perhaps in us? Something to think about.